Let's talk about the most common medication used to treat a urinary tract infection or UTI, so stay tuned. What's up guys, hope everyone's been doing well. For those of you who don't know, my name is Edgman and I'm a pharmacist, and I enjoy making these videos about common questions patients have about medications or any healthcare related topic, so make sure you subscribe for more content. Now to the rest of the video. The most common medication used to treat a UTI or urinary tract infection is called Nitrofurantoin, also known as Macrobid. And the way this antibiotic works is that it's thought to inhibit cell wall synthesis of the bacteria that's causing your infection, thus preventing it from replicating, which eventually kills off the bacteria. Alright guys, so here's the medication, Nitrofurantoin. It's a generic. We don't stock the brand. I don't even think the brand is available. Let me show you guys the capsules. It actually says Macrobid on them. If you guys could look on the where the black part is, it says Macrobid, which is the brand name of the medication, but this isn't the brand name. And then I want to point out something. This is Macrobid, right? Here we have another medication, or actually the same medication, Nitrofurantoin. However, these medications are not the same. They're not equivalent. Even though if you look at them, it has the same active ingredient, Nitrofurantoin and Nitrofurantoin, same medication, same dose, but these are different medications. If a doctor writes for Macrobid, if I give this medication, that's wrong. It's the wrong medication to give. And in my next video, I'll be doing a more deeper detailed dive in what are the differences between these two, because there are some. You could see maybe it says monohydrate macrocrystals and then just says macrocrystals. So in my next video, I'll be talking about the differences between these two and what goes into the actual salt formation or the formulation of these two different medications and why they're not the same. So make sure to subscribe and stay tuned for my next upcoming video. I'm just giving a little teaser right now. Now let's talk about why Nitrofurantoin is such a good medication for treating against a urinary tract infection. The first reason is Nitrofurantoin covers E. coli infections. E. coli is a bacteria, it's a gram-negative bacteria that is one of the most common pathogens that cause a UTI. So Nitrofurantoin covers or is effective against killing E. coli bacterial infections. So that's the first reason why it's a good medication, because you have to have an antibiotic that's effective against the infection. The second reason why is that Nitrofurantoin concentrates in the urine. So having an antibiotic that's effective against that specific bacteria is very important. However, it's just as important to make sure that the antibiotic can get to that site of infection. So for example, if Nitrofurantoin cannot get to the urine where the UTI is, then it wouldn't really be effective medication, even though it covers very well against E. coli. So Nitrofurantoin concentrates a lot in the urine, which is where the infection is, which makes it a very ideal medication or antibiotic to treat against a UTI. Nitrofurantoin is typically dosed at 100 milligrams twice daily for about 5 days, so you get a total of 10 capsules. And for prevention or prophylaxis of a UTI, you typically dose it once at bedtime. Now, fun fact, Macrobid, which is the brand name, ends in BID. BID in medical abbreviation means twice daily. So it's an easy and a quick way to remember how many times a day you should be taking your Macrobid twice daily. Now for some counseling points for those of you who are taking Macrobid. First, you want to make sure you take it with food to prevent stomach upset and also to help with better absorption of the medication. Secondly, you want to be aware that this medication might discolor your urine, and the typical color that's been reported is like a brownish discoloration of your urine. So keep that in mind when you're taking this medication. And of course, with Macrobid and any other antibiotics, you want to make sure to finish the full course of treatment, even if you are feeling better and have no symptoms, to fully treat your infection. And also, it's not recommended and it's best to avoid Nitrofurantoin during your last trimester of your pregnancy. So just keep that in mind. I hope you guys enjoyed watching this video and learned something new. If you guys did, please give me a big thumbs up and make sure to comment any feedback or questions you guys have for me. Until then, I'll see you guys next time. Thanks for watching.